Welcome to the Learning Corner. Do you know what dysentery is and it can affect you? Dysentery, often seen as a relic of history, is very much a present-day concern. It's an infection that targets your intestines, leading to severe diarrhea marked by the unnerving presence of blood and mucus in the feces. This isn't just an upset stomach, folks. It's a condition that can rapidly drain your body of vital fluids and nutrients, leaving you weak and dehydrated. While many of us in developed nations may not think about dysentery often, it remains a global health issue. It is particularly rampant in areas where sanitation is poor, striking with impunity at those least equipped to fight it. This is not a disease that discriminates. It affects people of all ages, from all walks of life. It's a silent assailant that can turn deadly if not properly treated. Understanding dysentery is the first step to preventing and treating it. Let's delve deeper into this topic. Consider subscribing for more insightful video content. Now let's dive into today's topic. So, what causes dysentery? Let's dive right in. Dysentery is primarily caused by two types of pathogens: bacteria and amoebas. Yes, it does sound a bit like a science fiction movie, but this is the reality of dysentery. The bacterial form of dysentery is caused by an unwelcome intruder named Shigella. Shigella is a group of bacteria that can invade the digestive tract and wreak havoc. This type of dysentery, often referred to as bacillary dysentery or shigellosis, is quite prevalent. On the other hand, we have amoebic dysentery, caused by a microscopic parasite known as Entamoeba histolytica. This amoeba, as the name suggests, loves to live in human intestines. It's not a pleasant thought, but it's crucial to understanding the cause of dysentery. Now, how do these pathogens get into our bodies? The usual suspects are contaminated food and water. Imagine a scenario where someone with dysentery doesn't wash their hands properly after using the restroom. If they then handle food or touch surfaces that others come into contact with, they can pass the pathogens on. The same goes for water. If it's contaminated with fecal matter carrying these pathogens, anyone who drinks it or uses it to prepare food can get infected. In essence, poor sanitation and hygiene are at the heart of dysentery's spread. It's not so much about the food or water itself, but rather about the cleanliness of the environment in which they exist. A single lapse in sanitation can lead to an outbreak of dysentery, affecting many people. The risk is even higher in areas where access to clean water and sanitation facilities is limited. In such places, the bacteria or amoebas find an ideal breeding ground, and dysentery can spread rapidly. So, in a nutshell, dysentery is caused by two main culprits: the Shigella bacteria and the Entamoeba histolytica amoeba. They commonly enter our bodies through the consumption of contaminated food or water, thriving in conditions where sanitation and hygiene are compromised. Therefore, the root cause of dysentery lies in poor sanitation and hygiene. Now, how can you tell if you or someone else has dysentery? That's a crucial question. Dysentery, like many illnesses, reveals itself through a series of symptoms. These symptoms are your body's way of alerting you that something's not quite right. The first and perhaps most noticeable symptom is bloody diarrhea. This occurs because the bacteria or parasite causing dysentery attacks the lining of the intestines, causing inflammation and ulcers. These ulcers can bleed, leading to blood in the stool. This symptom is quite alarming and should never be ignored. In addition to bloody diarrhea, stomach cramps are a common symptom. These cramps can range from mildly uncomfortable to severely painful. They are the result of your body trying to rid itself of the infection. Nausea and vomiting may also occur. These symptoms can lead to a loss of appetite, which can, in turn, lead to another symptom: rapid weight loss. If you're losing weight rapidly without trying, it might be a sign of dysentery or another serious health condition. Another symptom to watch out for is fever. A fever is your body's way of fighting off infection. If you have dysentery, your body temperature might rise as your immune system tries to kill off the bacteria or parasite causing the infection. Finally, you should know that these symptoms usually appear between 1 to 3 days after exposure to the bacteria or parasite causing dysentery. This means that if you've been in an area where dysentery is common, or if you've consumed contaminated food or water, you should be on the lookout for these symptoms within the next few days. It's important to note that these symptoms can also be caused by other illnesses. Therefore, if you're experiencing these symptoms, it's essential to seek medical attention to get a proper diagnosis. If you experience any of these symptoms, especially bloody diarrhea, seek medical attention immediately. Remember, dysentery is a serious illness, but with swift action and appropriate medical care, it can be treated effectively. Now that we've identified the symptoms, what can be done to treat dysentery? The answer to this question lies in two key areas: medication and hydration. Let's first delve into the medication side of things. The type of dysentery you have determines the medication you'll need. If you're dealing with bacterial dysentery, antibiotics are the go-to solution. Antibiotics work by killing the bacteria causing the infection, thereby alleviating the symptoms and paving the way for recovery. On the other hand, if you're grappling with amoebic dysentery, the situation calls for antiprotozoal drugs. These are specially designed to target and eliminate the amoebas that are the root cause of the disease. However, it's crucial to remember that self-medication can be dangerous. Always consult a healthcare professional before starting any medication regimen. They will prescribe the appropriate medication based on your condition and guide you on the correct dosage and duration of treatment. Now let's move on to the second part of our treatment strategy: hydration. Dysentery causes severe diarrhea, which can lead to dehydration. This can further complicate the recovery process, making the body weaker and more susceptible to other infections. Hence, it's crucial to replace the lost fluids and electrolytes. This is where oral rehydration salts come into play. These are a mixture of salts and sugar, which when dissolved in clean water, create a solution that can help to replace the lost fluids and electrolytes. In more severe cases, where oral rehydration is not sufficient, intravenous fluids may be necessary. These are administered directly into a vein, providing immediate relief from dehydration. In summary, the treatment of dysentery involves a two-pronged approach: medication to kill the bacteria or amoebas causing the infection, and rehydration to replace lost fluids and electrolytes. Remember, dysentery is a serious condition that requires immediate medical attention. If you or someone you know is showing symptoms, don't hesitate to seek help. While medication is important, hydration is key in the recovery process. But wouldn't it be better to prevent dysentery in the first place? Indeed, it would be. So let's delve into the various ways we can keep dysentery at bay. At the heart of it all is good hygiene. It's the cornerstone of preventing not just dysentery, but a multitude of diseases. This includes washing your hands regularly, especially before meals and after using the washroom. Hand sanitizers are a good alternative when there's no soap and water around, but they're not a substitute for good old hand washing. And while we're on the topic of cleanliness, let's not forget about the food we consume. Street food may be a tantalizing treat for your taste buds, but it can also be a potential breeding ground for the bacteria that cause dysentery. This doesn't mean you have to swear off street food forever, but it's wise to be cautious, especially in areas with questionable sanitation standards. And it's not just the food that you need to be mindful of, but also the water you drink. Unclean water is one of the most common sources of dysentery. So if you're unsure about the water quality, it's best to stick to bottled water. Or if that's not possible, boil the water before drinking. And it's not just for drinking, but also for brushing your teeth, washing your face, and even for washing fruits and vegetables. It's also worth mentioning that if you're traveling to a region where dysentery is common, it might be a good idea to get vaccinated. There are vaccines available that can offer protection against some forms of dysentery. In short, prevention of dysentery revolves around maintaining good hygiene, being cautious about what and where you eat, ensuring the water you consume is clean, and getting vaccinated if you're traveling to a high-risk area. It's not complicated, but it demands a certain level of vigilance. Remember, prevention is always better than cure. So let's be vigilant about our health and keep dysentery, along with other diseases, at bay. So, let's quickly summarize what we've learned today. Dysentery is a health condition that primarily affects the intestines, leading to severe diarrhea. It's caused by specific types of bacteria or parasites that we often ingest through contaminated food or water. The symptoms, remember, can vary, but most commonly include abdominal pain, fever, and frequent, often bloody diarrhea. If you encounter these signs, it's important to seek medical attention promptly. In terms of treatment, antibiotics are typically the first line of defense. Alongside this, staying hydrated is crucial to combat the fluid loss from diarrhea. And how can we prevent dysentery? Well, it's all about practicing good hygiene. Washing your hands regularly, especially before meals and after using the restroom, is key. Ensuring the water you drink and the food you eat is clean and safe is another vital step. By now, you should be well equipped with knowledge about dysentery, what it is, how it's caused, how to identify it, treat it, and most importantly, prevent it.